my name is Amber Goana, and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this Med Talk, we're going to be talking about some medications that have FDA approval for contraceptive, aka your birth controls, some general side effects of people who have a excessive amount of estrogen. You might have a migraine. They might see like brown patches of hair develop on their face. They can be nauseous, get breast tenderness, edema, which is like swelling, bloating. Their stool can be a real mucousy like consistency, and they have a higher incidence of getting DVTs or PEs, which is different types of clots. If you are deficient in estrogen, you might see spotting or like breakthrough bleeding, usually between weeks 1 and 2 of your cycle. You can have hypomenorrhea, so you can be bleeding kind of less, you don't really bleed that much, or you can have amenorrhea, which you don't even have a period at all. Some things you might experience if you have an excess of progestin: you could have an increased appetite, weight gain, you can get tired or fatigue, depression, also hypomenorrhea, so you could have like less bleeding in your period. Androgen effects like lots of acne, and you can be losing your hair, or you can have hirsutism, which is also something to do with hair growth. It could be on your face, but also your chest or your back. If you are deficient in progestin, you might see spotting or breakthrough bleeding in the late cycle, like the last 10, 21 days of your cycle, you might have some breakthrough bleeding. You could have dysmenorrhea, cramps, very bad cramps, or you can have hypermenorrhea, which is like excessive bleeding, like you bleed a lot. So there are like 100,000 birth controls. There are so many birth controls. Oh my gosh. So we have monophasic formulations. So this medication is going to provide the same dose of estrogen and progesterone throughout all the active pills. Every single day that you're taking an active pill, it's going to be the same dose of estrogen and progesterone. One option is Loestrin. That's about less than 30 micrograms of estrogen. Same with Janelle, Yaz, Mycogestin, and Alice. All of them have 21 active pills and 7 placebo pills. This is good for patients who have a high risk factor, like they're a smoker, they have breast cancer history, they're like a cancer survivor, they have a gallbladder disease, or they're postpartum 42 days after they just had a baby, they have hypertension, or they're on certain drugs like anticoagulants or rifampin or a protease inhibitor because their liver enzymes are kind of affected. Other examples of monophasic formulations of estrogen and progesterone are Yasmin and orthocycline, but these have greater than 30 micrograms of estrogen in them. These are good to use in patients with spotting in the first 2 weeks. Then we have a multiphasic formulation, and this mimics the natural hormone levels throughout the menstrual cycle, so it's kind of going to really kind of regulate someone who's just kind of trying to get a regular cycle going. We have the orthotricycline, it's biphasic. We have Trospringtec, it's also biphasic. And then we have Natiza, it's quadriphasic. So the dose is going to change over the days 21 through 24. And this nizatasic, where it's quadriphasic, it's going to be the closest to your natural cycle. And then we have alternative cycle options. So this is going to be like your Sequin, it's It's an extended cycle, so it's 84 days of active pills, and then it's going to be 7 days of placebo. So you're going to have a period like every 3 months. And then we have Amethyst, which is a continuous formulation. All 28 of those pills are going to be active. There are no placebo pills. So these alternative cycles are good for patients with heavy menstrual bleeding, or they have some sort of mood disorder. Next we have drospirenone containing formulation. These are going to be your Yasmin, Yaz, and the Yaz can be used in premenstrual dysphoric disorder. And that's just kind of like when the woman's getting ready to start and it's like a week or two before that and they're already having like, moodiness. There's also Janvi, Biyaz, Nika, Vesturil, and Ocella. All of these drospirenone containing formulations have like a mild potassium sparing diuretic effect, which is going to help reduce bloating, but no androgenic activity. It's not going to cause the release or stimulation of, it's sort of like what a lot of males have. It's not going to really cause that effect, but it is going to help reduce bloating. All of those have less side effects. They're good for use in patients with acne or fluid retention because they have that diuretic effect. You want to caution use with ACEs and ARBs. So if they're on losartan or lisinopril, you just kind of want to watch out for that. Or if they're on tacrolimus or cyclosporin, because those can also kind of increase your potassium level. You need to monitor their serum creatinine. Next we have progestin only pill. It's like a mini pill. We have the Erin, Norab, and Camila. All 28 of these are active with a fixed dose of norethindrone, no estrogen. It must be taken within 3 hours of the same time every day. It's good for use in people who are breastfeeding or they just had a baby, they're postpartum, like 6 weeks after. They have hypertension or migraines, some medications that can really just decrease the efficacy of these birth controls. And this is not really a complete list, but just for in general, anticonvulsant, phenytoin, topiramate, lamotrigine, carbazepine, barbiturates, and oxycarbazepine. You have the St. John's wort, smoking, the protease inhibitors, especially the ritonavir, some antibiotics, especially like rifampin, and clovacevilam, which is usually used for like cholesterol type things. You want to separate by 4 hours because of that absorption. We have one patch option, which is your Xlunane. This patch is applied once a week for 3 weeks and then off for week 4. So there's going to be 3 patches in that box, and it's going to be for a 1-month supply. It's less effective in women if they weigh more than 198 pounds. It has a high systemic estrogen exposure, so it has a pretty significant increase in causing a DVT or PE, some sort of clot. Then we have a ring version, NuvaRing. This is inserted for weeks 1 through 3, and then it's removed for week 4. So this box is going to have 1 ring in it, and it's going to be for a 1-month supply. You want to avoid in patients who are greater than 35 years old, or if they are a smoker, because it has an increased risk of causing cardiovascular complications for them. We have an injection version. You have your Depo-Vera. It's 1 shot IM once every 3 months. So it's pretty good for non-inherent people because they just literally, you get them in office, you go and shoot them with this shot. They don't have to worry about taking anything or removing anything or none of that mess. They just 1 and 3 months later they come back. Patients who are taking this injection version are going to experience amenorrhea, so they're not even going to really have a period. They could also lose some bone mineral density, and they could see weight gain. Now we have some long-acting reversible contraceptives. So these are going to be kind of like those something that's implanted in the doctor's office. So we have the Nexplanon. It's going to contain progestin and etonogestrel. It's implanted every 3 years. So one Nexplanon is good for 3 years. Then we have your Mirena. That one's good for 5 years. So is Skylar, Kalina, and Latia. Those all are good for 5 years. The Paragard is good for 10 years. It's actually non-hormonal. It doesn't have any hormones at all. It's actually copper. It's the first line treatment for an emergency contraceptive, and it's suggested to use within 5 days of unprotected sex. Again, all of those long-acting reversible contraceptives have to be implanted in a doctor's office setting, and they're good to use for patients who have heavy menstrual bleeding or cramping. Some other emergency options. Again, remember the Paragard is the first line option though, that copper IUD. It has to be used within 5 days of unprotected sex. It requires clinical setting because it does have to be administered in the doctor's office, but it's good for 10 years. You got the Ella. It's the second line option. It's less effective if the patient weighs more than 198 pounds. It needs to be taken also within 5 days, but that one's available prescription only. You can't buy that over the counter, the Ella. It works by delaying ovulation. It's known to cause headache and abdominal pain. The third line option we have is Plan B. It's less effective if the patient weighs more than 165 pounds. It needs to be taken within 3 days of unprotected sex. It is available over the counter, which is great. It works by preventing or delaying ovulation, and it kind of thickens the cervical mucus. It's known to cause nausea, and if the patient actually vomits within 2 hours after they take it, they will need a second dose. And you know, I'm sure they have come out with quite more birth controls that are not listed here. There's just 100,000 of them, but that's all that they had listed. So that's all I'm going over. Again, my name is Amber Gawana, and I wish you the absolute best of luck in all your studies.